Welcome back. Today we're going to talk about an easy, no tablet, minimally invasive treatment for overactive bladder, which is a symptom complex of frequency of urination, so going often, urgency, a feeling that you've got to go straight away, sometimes urgency incontinence, that means losing control if you don't quite make it, and sometimes going at night. It's a really frequent problem, it's really problematic, and the solution that we're talking about today is called PTNS, so stay tuned. So this treatment is PTNS, and that is percutaneous tibial nerve stimulation. It's stimulation of a nerve just above the ankle to modulate the nerves that go to the bladder. By the end of the video, we'll give you a clear explanation of why we use it, who we use it in, and I'll show you some video of the treatment in action. Why do people get overactive bladder? Sometimes it's associated with diabetes, sometimes with a neurological problem, sometimes in men with prostate problems, but more often than not, it's a problem that can just pop up, and we call that idiopathic overactive bladder. It does seem to be related somewhat to aging, but not in everyone. It's not a disease process in itself. All we're doing with overactive bladder is describing a complex of symptoms. That's the frequency, the urgency, sometimes urgency incontinence, and going more than once at night. Various treatments are available, and these can include lifestyle changes, physiotherapy, and sometimes tablets, which do come with side effects. PTNS is suitable for some people, and you do need to talk to a urologist about whether it's suitable for you. So the control of micturition or voiding is a complex process. It's under neurological control, and ultimately the brain controls this. It passes information down the spinal cord where there's integration. There are nerves that go to the bladder that can inhibit or contract the bladder, and there are nerves that come back from the bladder to speak to the spinal cord to tell it what's going on, and these come from various areas and various pathways, and the integration of all of this occurs in the spinal cord. The level of the spinal cord, so this is sort of S2 to S3 particularly, also supplies the tibial nerve at the ankle. And we know that stimulation of this tibial nerve very gently on a regular basis can somehow cause some changes in the spinal cord just at that level, perhaps changes in the nerve, perhaps even changes in the bladder, which help control the problem that we've got and control this issue of an overactive bladder. Here we can see a diagram of PTNS in action, and we've got some video which shows the stimulation of the tibial nerve. A very small needle is inserted next to the tibial nerve. It doesn't hurt, and there's a stimulator attached to this. We turn up the intensity on this until there's some contraction of the muscles of the feet, and then we know we've got the right amount. And then just for half an hour, the nerve is very gently stimulated, and the patient just sits and reads a book. Now this happens for half an hour over a 12-week period, so it's half an hour once a week for 12 weeks for the initial treatment. So the real question is, does this work? Well, there's a large number of studies in the literature that demonstrate that it does work really nicely, and there's a list here of some of the bigger studies. I'll take you through some of the results of these randomized controlled trials and the meta-analyses of all the studies, which is the highest level evidence possible. So the first study looked at sham treatment, which means putting a needle in and attaching the stimulator but not stimulating, compared to the actual treatment. And you can see here that there is a significant improvement for those patients who had stimulation. The next and most important thing is, does it work for patients? And you can see here 2 randomized controlled trials in blue and 2 meta-analyses in grey show that there is a significant improvement in overactive bladder symptoms for those patients who are treated with PTNS. And the final really important question is the effect maintained over time? Well, we can see from this study that there is fairly clear evidence of grey in baseline, and then at 13 weeks and 3 years, that the frequency is improved, the urgency remains improved, incontinence episodes remain improved, and nighttime voids, that means going at nighttime more than once, is also improved. So it is a maintained response. So in our practice, this is bulk billed, and our practice nurse Louise helps with the treatments and will look after you while you come into the outpatients for this treatment. Please don't hesitate to get in touch with us if you'd like to come and talk about this treatment. Our contact details are here, and they'll be at the end of the video as well. This is the 3 of us at EastWestUrology: Dan Spurnett, Mark Lloyd and myself, and any of us would be happy to talk to you about these or other treatments for overactive bladder. Many thanks indeed, and we look forward to seeing you.